Good afternoon, everyone, and thank you so much for joining for this media briefing. The Chief Medical Officer, Dr. the Most Honorable Kenneth George, and Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman, will speak to the COVID-19 situation on the island, what is expected when persons go out tomorrow night to party, and some of the measures that will be implemented to guide the election campaign, among other issues. And Dr. George will begin.
So, good afternoon, all, and let me take this opportunity to wish persons who are hearing my voice a happy new year and one filled with whatever you need or whatever you want. I wish that you and your families have a happy and prosperous new year. As you will recall, we are approaching nearly 2 years into the COVID pandemic, and we have gone through the Alpha variant, we have gone through the Delta variant, and today I would like to spend a little time on Omicron. We have been consistently saying to the public within the last 2 to 3 weeks that the likelihood of Omicron being within our borders was high. And we had a reason for saying this because the experience in several other countries across the globe indicated that the virus spreads extremely rapidly within communities, and therefore Barbados was not going to be spared. We have had confirmation of Omicron by the CARPHA Public Health Laboratory, a single case. And to date, that is the only confirmed case we have had. However, I must couch that by saying that we have been doing testing, preliminary sequencing at the Best DeSantis laboratory. And there's also preliminary evidence that Omicron is established in Barbados. We do not need to panic. We have come this road before. Let me give you some of the experiences in 2 countries that you may be aware of. In France, a single daily total of 200,000 new cases occurred yesterday. And in the United Kingdom, it was about 180,000 new cases. If you go across the Atlantic, within 2 weeks, the positivity rate for new cases in the United States went from 3 to 4% to over 70% of all new cases. Therefore, implementing border controls, while it may have had some use in the Delta variant in Barbados, border controls will not be the only method to stop the spread of virus. And particularly, as I said, it is within our communities. The other issue that I have, and you may have noticed, is within the last 5 to 6 days, there has been rising numbers of cases. So for example, today, we have 240, for yesterday I'm reporting, we have 247 new cases out of approximately 1,483 tests. And this number has increased over the last week. Our indices are trending upwards again. They are effective when it was well below 0.8 is now 1.44. That means that every individual or every 2 individuals is likely to transmit the virus to 3 persons. That's the easiest way of looking at it. So our cumulative 14-day per 100,000 has increased, along with the 7-day per 100,000 cumulative average has increased also. And therefore, we are seeing trending upwards. Therefore, at this juncture, the assumption is that we have said this before, Omicron is here. We have sent laboratory samples to the Caribbean Public Health Agency, and we expect to have these results in 7 to 10 days. Those samples were carefully selected because either of low CT values or unusual presentations. Once we have this information, we will share it with the public. So how can you protect yourselves at this point in time? Well, what we know, we have to get knowledge first. Omicron is highly contagious. It spreads easily. On the good side, we have been informed by several studies in different countries, including the United States and the United Kingdom, that the level of severity of the disease and deaths appear to be lower than Delta. So on one hand, you have a virus that has the potential to spread very quickly, and on the other hand, you have, from preliminary reports, a virus that doesn't cause as much sickness and fatalities. The challenge is that 2 things happen in Barbados. One, we have a vulnerable population who is elderly, and we have a high burden of NCDs. And those 2 groups have characteristically taken the burden of illness in Barbados. And therefore, although the likelihood of severe disease and death is not as high, just based on volumes, we have the potential to overrun our healthcare system, which we are trying so ever to protect. Therefore, with that information, I urge you to do the following. Wear your masks at all times when in public spaces, or when you are in close quarters with one another, or when you are in indoor buildings. That is absolute at this time. Practice the physical distancing that we have spoken about since the beginning of this pandemic. Use hand sanitization as frequently as possible. And finally, let me speak on the issue of vaccines. Now, vaccines offer protection, and we have been saying this to the public. Fortunately, we have gotten to approximately 62% of the eligible population who could be vaccinated are vaccinated, and I am happy with that. I would like to see our goal before mid-year to be 75% of the eligible population. So I'm again asking the public to work with us. We also know that boosters are well available in Barbados, and that from where we sit and the limited information we have on Omicron, persons with boosters have even better protection. And therefore, I use this opportunity that we are currently at 42% of the population who can be boosted, are boosted, and I would like to see that rise. So I'm encouraging persons to come forward and to know that all our sites have boosters available, and there are 4 vaccines that are available to Barbadians: Pfizer, Sinopharm, AstraZeneca, and Johnson & Johnson. So as we look forward to the new year, we believe in the Ministry of Health that COVID will be with us for the long term. We have put proposals on the table to make COVID more like the flu, and for persons who to understand that we have to live with the hand we were dealt with, and to normalize the process of living in Barbados with COVID. I want to take again this opportunity to wish all individuals a very blessed new year. And we in the Ministry of Health, as I have said before, will be here working in the background and in the foreground to ensure that our population is kept safe. Thank you so much.
And thank you as well, Dr. George. We now go to Mr. Chapman.
Good afternoon. I would like to echo the sentiments and greetings made by Dr. George to wish all Barbadians a happy, a prosperous, a healthy, and a safe new year. As you would know, in the recent past, we would have had conversation with promoters, including the NCF, which is the largest promoter in the country, concerning the conducting of approved organized events. And a number of these events would have been applied for. So far we've had a number of applications. 6 of those applications have been approved for All Year's Night. There has been another 5 for the first day of the new year, and 1 more for the second. We anticipate that others will apply, and once those applications are made, we will process them accordingly. It must be said, for events to be approved, there are a number of protocols which has to be followed. The first one being that persons who are conducting such events have to apply to the COVID-19 monitoring unit as well as the National Cultural Foundation. Once that is done, the event is categorized in terms of indoor and outdoor. For the purpose of things such as parties and those sort of events where persons are standing, those events are only approved for outdoor spaces. There are no parties approved for indoor spaces at this time. As part of that protocol, both the promoter and the staff of the event have to be both vaccinated and tested on the night of the event, and the patrons will either be vaccinated or tested 1 day prior to the event. These protocols are put in place so as to ensure that we have events that are low risk and that persons can enjoy some semblance of normalcy for the All Year's Night and New Year's Day. I must emphasize that only those organized, approved events are allowed at this time. If persons want to go ahead and have an event such as that, they would need to send the necessary application through the NCF to the COVID-19 monitoring unit. So what we have also, I would also like to speak shortly on the whole issue of elections and so on. As we all know, our elections will be on the 19th of July, sorry, of January, sorry. Yes, I'm just as shocked as everyone else. It is on the 19th of January. A number of protocols have been put in place to ensure that these elections within a COVID environment can be conducted safely. We are asking Barbadians to please conduct yourselves in a manner that is befitting to what is a Barbadian, that we be our brother's keeper, that we act in a manner that ensures that our neighbors are kept safe and we ourselves are kept safe. The non-pharmacological interventions that were mentioned by Dr. George, the washing of hands and sanitizing of hands, good hand hygiene, the proper wearing of masks, the physical distancing, and being as much as possible in good ventilated areas is something that we want to ensure that we do during this period of electioneering, nomination, polling, and so on. It is critical that we recognize that although this is a time, the time we usually call the silly season, that we must act wisely. As the Prime Minister would normally say, we must apply our hearts to wisdom during this period of time. So you will realize that a lot of the events and meetings and so on will be streamed. Spot meetings and so on are still allowed, they will still go on. And there are a number of restrictions and so on in terms of the larger political events. So during this time, the COVID-19 Monitoring Unit and the Electoral and Boundaries Commission would have put a number of protocols in place. A lot of these protocols were used in the St. George North by election, so we would have seen them, we would have put them in place, we would have seen them work. And we would have just tweaked them and expanded them where necessary for the national election. So for this purpose, we are just requesting that as we go to the polling stations, as we go to political events, meetings and so on, spot meetings and so on, that we remember that we are still in a COVID environment. And although we can get quite animated and enthused by our candidates and those and the messages that they bring, we ask you kindly, please think of your brother, think of your family back home, and do all the things that we know are necessary to prevent us from spreading COVID-19. Thank you.
Thank you very much, Mr. Chapman. As we open for questions, as customary, I would ask members of the media to identify themselves and the media house they represent. Your questions?
Good afternoon, Dr. George. Barry Allen here from the Nation newspaper. Are you in a position to tell us, in terms of volume, how much sequencing or testing has been done so far by the Best Dos Santos lab, and how many samples would have been forwarded to CARPHA? That's the first question. And the second question would be, can the Ministry of Health tell us when the one Omicron person would have entered our borders? Source market?
So the source market is not important the way how Omicron spreads. If it came from, I don't know where the source country was, but if you think about it, the source market is not the critical issue. We knew about this 5 to 6 days ago. As I said, it was a single confirmatory case. And the Santos Laboratory has been doing preliminary testing. And that preliminary testing involves looking for the concept of the S gene dropout. And that S gene dropout gives a feeling or a indication if this can be Omicron. We have always chosen to to indicate to the public that while we are aware of the work of the Best DeSantis Public Health Laboratory, our public health decisions will be guided by cases that are confirmed. But I have to say again that the assumption is that Omicron is established in Barbados. You are speaking of the index case, where it came from. But knowing the index case will not change the outcome or will not change the preventative measures. Secondly, we have done about 500, for the 2 weeks that we have been monitoring the Best DeSantis has been doing their preliminary testing. We have done about 540 tests, and about 40% of those tests showed the S gene dropout. And therefore, as I said, we have sent some of those samples to the CARFA Public Health Laboratory for confirmation. I don't know if many of you know, CARFA was a little slow over the Christmas time, the Christmas vacation. And therefore, once, as I said, those results are with us, they will be shared. But I don't want us to get, it's like originally when the start of the pandemic, everyone was fixated on where the index case was. There's no concept of index case in Omicron. Why? Because it has spread so rapidly. So while I understand your question, I don't think it adds much value to the discussion. What adds value to the discussion is how we will get over this, understanding that many persons in Barbados will be affected at some point in time, understanding very well that our numbers will continue to rise in the immediate future, and understanding that the public at large have good solutions at their disposal to assist the Ministry of Health in its work. So that is what I will say on that matter, and I will encourage that the focus, particularly in the new year, be more one of forward-looking, because I don't want us to get into a situation where we are blaming individuals for bringing virus into Barbados. That makes no sense. Thank you.
George, that S gene dropout percentage that you just brought to our attention, would that be considered high in a public health perspective?
Well, it's certainly of tremendous concern to us in the Ministry of Health. But as I reiterated, we can't make, there are other genomic types that have S gene dropout too. So I would prefer that while we understand that we are not in a good place, I will certainly get back to you with respect to more confirmatory cases. But again, the take-home message is let us behave as though we have the virus within our communities, and therefore let us act accordingly.
Next question.
Good afternoon to you, Dr. George, Wendy Burke, CBC. In terms of the spike that we've been seeing in recent times, have any of them come from any singular events? Do we have any super spreader cases in our midst, or is it just general lack of individuals failing to follow the protocols that has led us back to these rising cases?
So I don't think, it hasn't been brought to my attention of any single super spreader event like what occurred a year ago. You know, on reflection, when you look at how this virus is transmitted, it is very frightening that I can just be casually in a room and I can, just mix with an individual for a short period of time. and come down with virus. So there has not been any specific super spreader event. What I will tell you is that we are picking up more Barbadian non-nationals, and that has been clearly put out on every day, that number has been increasing, because the truth of the matter is that over the Christmas holiday, a lot of people wanted to return home, and that Barbados has always taken the position that absolute border controls don't work. Let me speak to this issue. The knee-jerk reaction of many industrialized countries was to shut their borders to the 6 African countries when this was first announced on the 28th of November of this year. It doesn't work. It is not a sound public health measure. The public health measures are based on what the public has that they can fix on their end, and not necessarily implementing stringent border controls. The other issue is that, remember early in the Delta variant, we did a lot of contact tracing. Contact tracing is a proven public health measure to reduce burdens of disease within our community. We're dealing with a different kettle of fish. Omicron does not subscribe to contact tracing. Why? Because it is highly infectious. And as I said, persons in Barbados, we must have the economy of Barbados moving forward. Life needs to return to normal. We are all under COVID fatigue. Let's live with it. Let's coexist with it. Do the correct things, but making sure that we are not consumed with COVID for 2022. I sincerely mean that. Healthcare is far too complex for the Ministry of Health to be only one-track focus. There are so many other areas in healthcare that I would like to see grow at the moment. And we have been guided and said that we need to get on with this. We need to get on with the public health functions of the essential public health functions of standard ministries of health, which try to advise and give guidance on public health issues of our time. Thank you.
Wendy, did you have a
Dr.
follow-up?
George? Yes, I have a follow-up. I'm glad that you mentioned getting on to the other areas of public health, because an area of concern to me is with the said NCDs and or elderly. Do you have any indications whatsoever of any nursing homes in recent days being severely impacted by COVID?
Yes, we are. Our response involves nursing homes. We have, in the last 2-3 weeks, about 3 nursing homes we have been looking at and managing. Once persons are positive within a nursing home, it is the responsibility of the Ministry of Health to ensure those individuals' safety and proper clinical management. And therefore, from time to time, we have had to institute programs to assist these nursing homes, whether it be removing the positive patients or whether it being asking QEH to render some human resources to the overall management of the nursing home. So the answer is yes. Remember, nursing homes are extremely vulnerable. And we will continue to do this, because the fact of the matter is that many of these nursing homes, the vaccine rates are north of 95%. So that's a good thing. And we are hoping that these individuals will have a milder course.
Next question.
Okay, just as a quick follow-up to that question, Dr. George, have any of them actually have to be rendered as isolation facilities in and of themselves because more than half of the patient population has come down with the virus?
Not at this time, but if that case comes to us, we will certainly use the limited resources at our disposal to make sure that those patients have the appropriate care.
Dr. George, with respect to booster vaccination, the original information we had was that people who would have received their second shot could get their booster around the 6-month mark afterward. Omicron is now here, and some international studies have suggested that people could actually get boosters a little earlier. Would you at this time advise Barbadians who may have surpassed maybe the 3-month mark to get booster shots, or would you still want them to wait 6 months before getting their booster shots?
So we can't make policy decisions on the fly, and whatever directions we had given before, we will stick to that. As you know very well, we're reviewing the evidence all the time. There's evidence coming from multiple sources. And once that guidance is so provided, we will be following the science. Just to let you know, though, that boosters are available and persons can go to any of the vaccine sites. We've been a bit more flexible with the boosters, so persons who have had 2 AstraZeneca may wish to select Pfizer, and there have been approved different combinations with respect to boosters. I heard Dr. Tedros recently speak as early as yesterday, again pleading with high-income countries to assist their brothers and sisters who are still struggling with vaccination rates under 10%. That's just unfortunate. We cannot, I honestly believe we cannot end COVID unless every country is safe. Because just the way how people travel and intermix, if America takes care of America and Barbados takes care of Barbados, we can't manage this. Because we don't live in a vacuum. So again, it's always been the position, I believe, of the government of Barbados and certainly the Ministry of Health with respect to vaccine equity and fair distribution of vaccines to the population. We are currently scouring the market as we speak to source vaccines for the 5 to 12-year-old children, because we believe that these vaccines are widely available in certain countries across the globe, but not to all. And we are working with with CARICOM, their help desk, in trying to source vaccines for the 5 to 11-year-old children in Barbados.
Are there any further questions?
I have one question for Mr. Chapman, Lisa. Thank you.
Sure, go ahead.
Mr. Chapman, you would have mentioned number restrictions at quote-unquote larger political events. Could you elaborate on that a tad, though, in terms of what number? What would be the number restriction? 150, 250, 300?
So at present, the agreement basically is that there will be 3 larger events. Parties can choose whether they want to have one at the beginning, the middle, and the end. That's their choice. And at those larger events, the restrictions would be 500 persons at this time. This is in keeping with the other events that we are presently having. So there is synchronicity within the events and so on.
Is the monitoring unit in a good position to be able to survey these events, Mr. Chapman?
Yes, we are. If you would remember, persons were recruited in the initial stages for the monitoring unit from each of the political districts, the 30 districts. This was in the initial stages when the monitoring unit was set up. The intention was that persons who live in each and every area of Barbados, who knew the area, would be able to interact better with the society. And actually that we are piggybacking now on that arrangement, which has served us quite well, to be able to do our monitoring for each of these events. I must say though that the crowd management and control is firmly in the grasp of the Barbados Police Service, and the COVID-19 monitoring unit is there to assist wherever necessary and possible.
Sorry, Dr. George wanted to come in here.
Yes, so I just wanted to add some clarity from a public health perspective. Guidelines have been issued by the Commonwealth and guidelines have been issued by WHO on the safe conduct of elections in a COVID environment. Remember, I started my discussion by saying we need to get to a level of normalcy. We have looked at those guidelines and crafted guidelines which I believe will ensure that the public remains safe. But however, based on the trajectory of COVID, the normal functions of government must continue. And therefore, we have had several examples of elections during a COVID period. Guyana, I think, was the first. There were elections in St. Lucia, and I think 4 other CARICOM countries had elections in a COVID environment. So that from a public health perspective, which I could only speak about, I am happy that those protocols address the following areas. The pre-election process with respect to mass gatherings of people and pop-up meetings, the nomination process, the election day process, the counting of ballots, and all of those behind the scenes operations that we have taken into account while we came up with the protocols. So the protocols are designed to give good guidance so that there will be no spread of COVID within this type of environment. And I am sure if persons so follow, there will not be any cases from this. Thank you.
Barry, did you have another question?
Yeah, just my final question for Dr. George. Regarding the scoring of vaccines for the 5 to 12-year-olds, Dr. George, about how many vaccines would Barbados need for our 5 to 12-year-olds?
We have estimated that about 28,000 to 30,000 vaccines for the 5 to 11-year-olds based on a 75% coverage.
And are there any further questions at this time?
Yes, I have a question. Good evening, everybody. Marlon Madden, Barbados today. I have 2 questions. One, you've indicated that some of these events we're expecting on Old Year's night and for New Year's Day, that patrons will be allowed to be tested on the spot. The FDA has warned that the rapid test is not so accurate in depicting the Omicron variant. So I wanted to find out what type of tests will we be relying on to give people permission to get into the events?
Go ahead.
I'm not familiar with that warning. What we do know is that the science have shown so far that the rapid antigen test is the one that we can use for to pick up whether or not some person has COVID, and that rapid antigen test is the one that is going to be used at those events. If persons have a negative PCR test, those results will be dealt with at a case by case at the night, but at the event. However, it is the rapid antigen test that we will be using to ensure that persons can have a safe event.
So the science on this is also evolving. So there are some conflicting information regarding the usefulness of rapid antigen tests in a COVID environment. But what I will tell you is the rapid antigen test gives the immediate status of the person within the hours surrounding that test. And we believe that based on that, persons will be able to enjoy themselves.
Marlon, did you have a follow-up?
Yes, a follow-up to that, but I have another question as well. I
Sure.
wanted to find out, is it that the rapid antigen test is known to give a false positive or false negative in Barbados?
So Dr. Beckles I don't like to stray in areas that I'm not competent in. Dr. Beckles is not here to answer these types of questions, but we will bear it in mind. We have 3 tests at our disposal. The standard PCR test, a rapid PCR test, and an antigen test. And all are useful. Some are more useful in particular situations. Rapid antigen tests give higher results if people have symptoms. The rapid PCR test is a credible test, but it doesn't come to the level of sensitivity and specificity of the standard real-time PCR test. So we have to work with what we have. And we have to try to create, as I said, some normalcy in our environment. And once we have the appropriate test, actually the Ministry of Health is even looking to source nasal testing for children to go back to school safely. Why? Because he wanted a non-invasive test for the children. So we continue to look to see what tests are out there and to make a determination which test is most suitable for which occasion.
Marlon, you had a final question?
Yes, Dr. George mentioned earlier that we needed to be more forward-looking, and you just mentioned about going back to school. But with the Omicron variant confirmed on the island, and notwithstanding it being a little bit milder, is opening schools for face-to-face lessons in January still something that you would recommend at this stage?
So we are quietly talking with the Ministry of Education, and I am not in a position to make a pronouncement on schools. What I would say at this time, and based on our numbers that are increasing, we have to be cautious, and that is how public health always moves. We have so many partners in this fight. We work with tourism, we work with education, we work with Royal Barbados Police Force, every agency you can think of. So we will continue to work with education. I know protocols have been developed, and these were pre-Omicron protocols. But certainly we may have to go back to the drawing board in some instances to get a better understanding of what are the risks associated with opening of schools in this environment.
Well, at this time, as we close, I would just like to thank the Chief Medical Officer, Dr. the Most Honorable Dr. Kenneth George, and Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman, as well as members of the media and you for joining. Good afternoon.